Since 1980, Médecins du Monde has been providing healthcare to the most vulnerable populations. These include victims of war, natural disasters or famine, and those who are excluded from healthcare. We care for those who the world is gradually forgetting. As an international humanitarian organization, Médecins du Monde's work depends on the commitment of volunteers, including doctors, nurses, logisticians and midwives. We also highlight human rights violations. We raise awareness among the general public, the media and policymakers, and we strive to improve the situation of populations. An international network of 16 members, an annual budget of 90 million euros. In total, 130 international programs and over 200 national projects in the countries of Médecins du Monde's international network, run by over 5,000 people. The Médecins du Monde's network runs emergency programs to help populations in distress. The field teams tackle epidemics, support civilian populations caught up in conflict, and respond to long-term crises. After the crisis phase, Médecins du Monde supports reconstruction efforts within each country. In the field, by training medical teams and collaborating with local partners, we guarantee the continuity of our projects in the long term. There are several priority themes for Médecins du Monde's international programs. Since 1986, Médecins du Monde's Mission France program has been improving access to healthcare for the most vulnerable groups in France and fights against exclusion. Mission France works with migrants, homeless people, Roma, sex workers and drug users. Health center-based programs and outreach projects are supported by 16 regional delegations in France. 21 healthcare and guidance centers in 23 towns in France. Nearly 80,000 consultations per year. More than 80 mobile programs to reach out to people who find it difficult to reach services. A buddying program for children in hospital who are far from home. Médecins du Monde is also an approved adoption agency. Observatories on access to healthcare in France and in Europe aim to improve access to healthcare for the most disadvantaged. To fund our work, Médecins du Monde relies on 65% private funding from individual donors, companies and foundations, 35% funding in the form of institutional grants. Médecins du Monde's accounts are submitted to external control organizations including the Cour des Comptes and the Charter Committee. I reject exclusion linked to poverty, deprivation or disease. When horror is hidden, I commit to bear witness. When barbarism breaks out again, I commit to fight it.